Thank you for joining us. In this presentation, we're going to focus on two closely connected areas, knowledge mobilisation and research impact. Our goal here is to inspire and support you to plan your knowledge mobilisation activities and to nurture the impact of your research. We believe this will help you to maximise opportunities for knowledge exchange and, as a result, enhance the impact of your research. It will also support you in capturing and sharing information and evidence related to the impact of your research. With that information, we can write case studies for funders, improve your grant applications and also your career prospects. And with some critical reflection, we can also understand what could be done better in the future. We draw on roughly 10 years of experience working in applied health research, collaborating with healthcare organisations and also individuals with lived experience. We use an evidence-based knowledge mobilisation and impact framework, which takes a building block approach to planning and evaluating impact. Developed in an applied life sciences research setting, forestry research, we in our Northwest Coast have found the framework to be highly transferable to applied health research. We've tailored it further to enhance its relevance for Faculty of Health and Life Sciences and believe it could be adapted for other subjects and faculties as well. Sorry, that went wrong. So why should you consider using the framework? Well, many research findings remain unused or are only accessible to a small academic audience. We believe that the framework will help you bridge the gap between research, policy and practice, ensuring that knowledge generated through your research is used effectively in real-world settings. And by making research more accessible and actionable, the framework can support you to accelerate the translation of evidence into policy or practice, helping to address social, health, environmental, or technological challenges much more quickly. This framework will support you to measure and demonstrate the impact of your work, helping you track how your research is used. Of course, many funding agencies now require researchers to demonstrate how their findings will impact society. And this framework provides you with a structure for your impact plan, helping you meet those expectations and making it more likely that you will be funded. The framework takes the building block approach to planning knowledge mobilisation activities and provides a structure for collecting evidence of impact. Identify and track what's happened as a result of the research, who and what we've influenced and why. So by using the framework, research teams and their partners can turn those isolated impacts of examples of impact and reasons for impact into meaningful narratives for both learning and dissemination. And that's through thinking beyond those direct impacts on policy and practice decisions, often called instrumental impacts, and identifying other changes their work has generated. And then by considering the relationships between processes that have led or could lead to impact, including uncovering those less obvious factors. And then finally, by reflecting critically on what has happened and what could be improved moving forward. So at the end of this presentation, you should have a greater awareness of how to generate and demonstrate the impact of your work. So we're going to talk about how to use the framework and take you through the building blocks approach that the framework is built on. I find the simplest way to start this is by asking the question, what changed as a result of the research? For instance, your research might have led to a better understanding of best practice when it comes to improving stroke care across the region. These are the so-called conceptual changes. Maybe your research paper offers recommendations for future practice aimed at making clinical trials more inclusive, so instrumental impacts. Or it could be that through your research, you've brought people together and they're working on new ideas, collaborations and relationships, what we call enduring connectivity. Or perhaps you've run workshops to build capacity in, for example, evaluating implementation of new healthcare services. Or perhaps your work has changed researchers' attitudes towards working with members of the public, and now they're starting to see the benefits of involving public in supporting their research and impact. Of course, you could also reframe the question as what could be done to ensure change happens as a result of our research. So the framework supports planning as well as evaluation. The second question is to ask who changed as a result of the research. And you might want to start off with your stakeholder analysis if you've already done one, or alternatively think about who has been influenced and who do you want to influence. Typically, we would group these into policymakers such as regional health and care organisations, local authorities, environment agency, DEFRA officials, and then practitioners such as paramedics, conservation managers, data analysts, technicians, and communities. So we can think about residents, local businesses. Then there are other researchers in other departments, maybe other topic areas, other countries, and then the public, so users of relevant services, formal and informal carers. We then look at the reasons why change happened, which strategies were used to generate impact, and what else, beyond the control of the project or the team, helped or hindered impact. Perhaps your project team was effective in framing the problem because research questions were discussed and refined by a roundtable of healthcare professionals, patients, advocacy groups, allowing all voices to shape the study to ensure that it's comprehensive and relevant to diverse needs. Maybe the way the research was managed, arranging as a roundtable, means that members from varied fields, so neurology, psychology, physiotherapy, patient experience groups, they've all collaborated, and this integration across disciplines means that each member contributes unique insights, so technical, scientific and experiential, to create a research environment that values diverse experience. In terms of inputs, a research initiative might, for example, draw on funding from both national programmes and local organisations. Perhaps it also leverages existing infrastructure, including access to labs, databases, and experienced staff. Engagement might involve the project team using collaborative design processes. Perhaps patient advocacy groups have helped raise awareness, provided feedback on materials, and motivated others to adopt the findings of the research. Perhaps the research will help us understand why a model of healthcare adopted in London or Manchester doesn't work so well in Lancashire or Cumbria. Of course, this understanding would then guide recommendations tailored to urban and rural health needs, aiming to reduce health inequalities. Outputs, these may have been co-created with patients and practitioners, crafted to be clear and accessible and relevant, and that ensures that the content is both practical and high quality. Dissemination might include webinars and short videos shared on YouTube, and podcasts or infographics ensure reach to both technical audiences and the public. And then finally, we can use the framework to reflect on what we can learn about identifying and generating impact. What has worked, what could have been done differently, and what could be done in the future. So what's next? Well, we've taken you through the framework and how you might use it to support your research. We've also put together resources to support you to use the approach effectively, including a reflective log with some worked examples, videos like this, and also games to help you think creatively about knowledge, impact, and how you would go about creating an impact.